If your feet have been doing something strange lately, especially at night, this is not something you should ignore. Because in many cases, it's not just your feet. It's your body quietly warning you that your blood sugar may already be rising, and in some cases, causing damage long before you ever get a diagnosis. Most people think diabetes shows up suddenly, in a lab test, at the doctor's office. But after more than 40 years working with patients over 60, I can tell you this with absolute certainty. Your body almost always whispers before it screams. And one of the very first places it whispers is your feet. Now, before we go any further, I want to ask you something simple. Have you noticed anything unusual in your feet recently? Tingling, numbness, burning, swelling, even something that just feels off? If yes, just type yes in the comments. It helps me understand what you're going through. I'd also love to know who I'm speaking with today. So take a quick second and tell me in the comments, where are you watching from? And if you feel comfortable, let me know your age as well. I read those comments and it truly helps me create videos that are right for you. Now, what I'm about to show you today could help you catch a problem early while you still have full control over it. Today, I'm going to walk you through 9 warning signs in your feet that may indicate your blood sugar is rising. And for each one, I'll show you what most people assume it is, what's actually happening inside your body, and one simple thing you can start doing today to protect yourself. And I want you to pay very close attention to sign number 7, because that's the one I worry about the most in my patients. Let me start with a patient I saw not long ago, a 68-year-old man. Retired, active, felt completely fine. He came in for a routine visit, nothing urgent. But as we talked, he casually mentioned, "Doctor, my feet have been tingling a little at night. Probably just age." That one sentence changed everything. Because by the time we ran his blood work, his blood sugar was already dangerously high. He had been living with diabetes silently for over a year. And his feet had been trying to warn him the entire time. Let's make sure that doesn't happen to you. Sign number 1, tingling or numbness in your feet. This is the one I hear about the most. Patients tell me, sometimes my foot just falls asleep. Maybe I sat too long. Maybe it's just circulation. And yes, occasionally that's true. But here's the question I always ask. Is it happening regularly, without a clear reason? Because if it is, this could be the very first sign of something called peripheral neuropathy. What's happening inside your body is actually very similar to what happens to a damaged electrical wire. Your nerves are like wires, and each one has a protective coating that allows signals to travel cleanly from your brain to your feet. But when blood sugar stays elevated, it slowly begins to damage that protective layer. Not all at once, but gradually, silently, like acid eating through insulation. At first, the signal still gets through, but it becomes distorted, fuzzy, unclear. And that distortion is what you feel as tingling, numbness, or that pins and needles sensation. I had a patient who described it perfectly. He said, "It feels like ants are crawling under my skin." That's not random. That's your nerves misfiring. And here's the part most people don't realize. This can begin years before a diagnosis. So what can you do starting today? The simplest and most effective thing? Start moving. A 20 to 30-minute walk every day improves blood flow to your feet and helps protect those nerve endings before more damage occurs. And just as important, begin reducing added sugar in your diet. Not next month, today. Sign number 2, burning sensation in your feet, especially at night. Now this one is the one patients often describe as the most distressing, because it doesn't usually happen during the day. It happens at night, when you're lying in bed and there's nothing to distract you from it. Patients tell me, "It feels like my feet are on fire," or "I have to stick my feet out of the blanket just to cool them down." Many people assume it's fatigue, or maybe they were just on their feet too long. But when it happens repeatedly, especially at night, this is something I take very seriously. Because this is another classic sign of nerve damage from elevated blood sugar. Here's what's actually happening. The nerves in your feet are no longer sending accurate signals. Instead, they're sending false alarms. Think of it like a smoke detector with a faulty sensor. There's no fire, but the alarm keeps going off anyway. Your brain receives a heat signal, even though there's nothing physically hot. The problem isn't outside your body, it's inside the nerve itself. And this usually means the damage has already begun. I remember one woman in her early 70s who told me she had been sleeping with a fan pointed directly at her feet for months. She thought it was just part of getting older. It wasn't. Now here's what you can start doing right away. Number 1, hydration. Drink enough water throughout the day. Your body needs it to help manage glucose levels and support nerve health. And number 2, increase your fiber intake. Foods like vegetables, oats, and legumes slow down how quickly sugar enters your bloodstream, which gives your nerves a chance to recover instead of constantly being under attack. Sign number 3, a small cut or blister that won't heal. Now we're moving into something more serious. This is the point where discomfort can turn into danger. I've had many patients come in and say, "Doctor, I had a small blister from my shoe. It's been there for weeks." They assumed it would heal on its own, because normally it would. But when blood sugar is elevated, your body's ability to heal changes dramatically. Your blood vessels, especially the tiny ones in your feet, begin to narrow and stiffen. And that creates a very real problem. Because your blood is responsible for delivering oxygen, nutrients, and immune cells to repair damaged tissue. But now that delivery system is restricted. It's like trying to water a garden with a hose that's been tightly bent. The water is there, but it can't reach where it's needed. So the wound stays open, vulnerable, and slow to heal. And that open wound can very quickly become infected. Is how many serious foot complications begin. Not with something dramatic, but with something small that was ignored. So here's what I want you to do starting tonight. After your shower, sit down and check your feet. Look carefully. Between your toes, around your heels, the bottom of your foot. If you see any cut, blister, or broken skin, clean it gently and monitor it closely. If it hasn't improved within 48 hours, don't wait. Get it checked, because early action here can prevent very serious complications later. Sign number 4, changes in skin color, red, dark, or bluish feet. This one is often missed because people assume it's just skin tone or aging. But there's a specific pattern I want you to watch for. If your feet or lower legs start appearing darker, reddish, or even slightly bluish, this can be a sign that blood flow is being compromised. Remember, your feet are the farthest point from your heart. They are the last stop on your body's circulation route. So when blood vessels begin to narrow, your feet feel it first. Think of your bloodstream like a delivery system. Your heart is the warehouse, and your feet are the final destination. If the roads become narrow or damaged, deliveries don't arrive on time. And when your feet don't receive enough oxygen-rich blood, the skin begins to change color. That's not cosmetic. That's a signal. I once had a patient who told me, "I thought my ankles were just getting darker with age." But when we examined her circulation, it told a very different story. Here's what helps. Simple daily movement. Even just 5 minutes in the morning. Ankle rotations, toe raises, light stretching. This gets blood moving and helps restore circulation to those smaller vessels. Sign number 7. Sharp, stabbing, or electric-like pain in your feet. Now, this is the one I told you earlier to pay very close attention to. Patients describe it like this. It feels like a sudden electric shock, like someone is stabbing my foot with a needle, like a jolt that comes out of nowhere. And many people assume it must be arthritis, maybe an old injury, so they take painkillers and try to ignore it. But here's the truth. This type of pain is often coming from damaged nerves that have become overactive. Instead of going quiet, they start firing randomly, sending intense signals to your brain, even when nothing is actually happening. Think of it like a car alarm that's been damaged. No one is touching the car, but the alarm keeps going off. Loud, sudden, and impossible to ignore. That's what your nerves are doing. And here's the danger. Painkillers don't fix this. They only mask the signal. And when you mask the signal, you delay action, which allows the damage to continue. I've seen patients live with this for years, thinking it was just part of aging. It's not. So here's what I recommend. Start with gentle daily movement. Even before you get out of bed, move your feet. Flex them. Rotate your ankles. Stretch your toes. Get blood flowing early. And at night, a simple foot massage can help stimulate circulation and calm those nerves. But most importantly, don't ignore this sign, because this is your body raising the volume. Sign number 8. Constantly cold feet, even when it's warm. Now, this one often gets dismissed as just poor circulation. People say, "I've always had cold feet. My feet are just sensitive to weather." But I want you to think carefully about this. Are your feet cold, even when the rest of your body feels warm? Are they cold under blankets? Cold even during warm weather? Because if the answer is yes, this is not about temperature. It's about blood flow. Your blood carries heat. So when your feet are constantly cold, it often means warm blood is not reaching them properly. Why? Because the blood vessels have narrowed or become stiff, which reduces circulation. Think of it like a heating system in your home. Your heart is the furnace, and your blood vessels are the pipes. If those pipes become narrow or blocked, heat doesn't reach the far rooms. And your feet are the farthest room, so they feel it first. This is often linked to peripheral artery issues, and it's very common in people with long-standing blood sugar problems. So what helps? Movement. Not just occasional movement, but consistent movement. A daily walk, even if it's just 10 to 15 minutes to start, can make a real difference. Because every step pushes blood down into your feet and helps keep those vessels open. Sign number 5. Cracked heels that don't improve. Now, this one surprises a lot of people because it looks harmless. Dry skin, right? But not always. When cracks in your heels become deep, persistent, and don't respond to moisturizers, there's often something deeper going on. Your body has a system of nerves called autonomic nerves that control things automatically. One of those functions is regulating moisture in your skin. When these nerves are affected, your skin begins to dry out from the inside. Not because of the weather, but because your body can no longer maintain proper hydration in that area. Think of your skin like a protective wall. When that wall starts to crack, it creates openings, and those openings can allow bacteria to enter, which increases the risk of infection, especially when healing is already slowed. I've seen patients apply lotion for years with no improvement, because the issue wasn't external, it was internal. Here's what you can do. Moisturize your feet daily, especially before bed. But just as important, support your body from the inside. Stay hydrated and reduce sugar intake so your nerves can begin to recover. Before we move on to the next sign, I want you to pause for just a moment. Think about everything we've covered so far. Tingling, burning, slow healing, changes in skin color, cracked heels. These are not random. These are patterns. And if you've noticed even one of them, your body may already be trying to get your attention. So let me ask you again, have you experienced any of these signs? If you have, type yes in the comments. And if you've noticed more than one, type more than one, because that matters. I read those comments and it helps me guide what I teach next. All right, let's continue. Sign number 6, swollen feet and ankles, especially in the evening. Now this one is often brushed off as something harmless. People tell me, I've been on my feet all day. I sit too long. It's just normal swelling. And yes, occasional swelling can happen. But when your feet and ankles are consistently swollen, especially if you notice deep marks from your socks at the end of the day, that's a different situation entirely. Because this is often a sign that your body is struggling to manage fluid properly. And in many cases, your kidneys are involved. Here's what's happening inside your body. Your kidneys act like a filtration system. Every drop of blood passes through them to remove waste and balance fluids. But when blood sugar remains high over time, it begins to damage that filtration system. And when that happens, fluid starts to build up in your body. Now here's where gravity comes in. That excess fluid doesn't just stay evenly distributed. It moves downward into your feet and your ankles. That's why the swelling is most noticeable there. I've had patients press their finger into their ankle, and the indentation stays there for several seconds. That's called pitting edema, and it's not something to ignore. It's a sign your body is under stress. So what can you do? Start with something simple. When you're sitting or lying down, elevate your feet slightly. Even a small elevation helps move fluid back toward the center of your body. And take a closer look at your salt intake. Processed foods, canned foods, packaged snacks often contain far more sodium than people realize. Reducing that can significantly improve swelling. But most importantly, if this is new, persistent, or getting worse, don't wait. Bring it up with your doctor. We've covered a lot today. 9 signs. 9 different ways your body may be trying to warn you. And here's the truth I want you to remember. These signs don't appear all at once. They appear gradually, quietly, one at a time, which is why so many people miss them. Not because they don't care, but because they don't recognize what they're seeing. But now, you do. And that gives you something incredibly powerful. Time. Time to act early. Time to protect your health. Time to avoid serious complications. So here's what I want you to do tonight. Before you go to bed, take just 30 seconds. Sit down. Look at your feet. Check the skin. Look between your toes. Notice how they feel. Ask yourself, is anything different? Anything unusual? Anything you've been ignoring? Because those small observations can make a very big difference. And if you noticed even one of these signs today, don't wait. Take the next step. Speak to your doctor. Get your blood sugar checked. Make a small change starting today, because the earlier you act, the more control you have. If you found this helpful, I want you to do one simple thing. Share this with someone you care about. A spouse, a parent, a friend. Because right now, there are so many people living with these signs, and they don't realize what their body is trying to tell them. And sometimes, one video at the right time can change everything. You might be the reason someone catches this early, and that truly matters. Now, if you'd like more guidance like this, practical, straightforward advice to help you stay healthy and independent after 60, go ahead and subscribe. Because in the next video, I'm going to show you something just as important. The everyday foods that can help bring your blood sugar back under control, and in some cases, even begin to reverse it naturally. This is something I've used with my own patients for years, and I think you'll find it incredibly helpful. Take care of your feet, and you take care of your future. I'm Dr. Alex Reynolds, and I'll see you in the next video.